Hello, I'm Dr. Mike Manheim here at the Grady Veterinary Hospital, and I'd like to speak with you for a moment on itch or pruritus in dogs. Realize that itch is a clinical sign. Itch is not a diagnosis, nor is it a specific disease process. Itch is one of the most common reasons that pet owners seek veterinary care here at the Grady Veterinary Hospital and at small animal veterinary hospitals across the country. The most common causes for itch are parasites, infections, and allergies. So when we think about parasites that cause itch in dogs, the most common parasite that we see on a regular basis are fleas. Fleas are wingless insects. They are parasites of dogs and of cats that literally start to take a blood meal within 6 seconds after mounting the pet and are laying eggs into the environment within 24 hours. So you can get a pretty good flea population build up in the house rather quickly. So what is one of the most common signs of a flea allergy dermatitis? It's itch. What's the easiest thing to do for that flea allergy dermatitis? And that's to keep your pet on flea control on a year-round basis. And not only the pet that is suffering the allergic response, but all the pets in the household. So year-round, all the pets in the household. That takes care of the number one parasite and the number one cause for itch in dogs. But there's many other things that cause itch in dogs. Certainly parasites such as mites, commonly called mange. We also see itch in association with infections, and these infections can be fungal, or they can be bacterial, or they can be a combination of the both. Many times, itch can be driven by allergies to food or to things that are inhaled, such as molds and pollens. So hopefully you understand that itch is just a clinical sign, and the diagnosis comes from a careful history and physical exam to find out what's the underlying reason for that itch response. The thought process within the veterinary profession around itch is that there is some dysregulation in the immune system combined with a break in the integrity of the skin, a major defense mechanism. So what can we do about that dysregulation in the immune system? Well, many things have been tried with variable success. Antihistamines may be something that your veterinarian has recommended for itch, but typically antihistamines only work in about 30% of cases. Once again, we're trying to manage a dysregulation in the immune system that's driving the itch response. Other drugs that have been used are drugs in the cortisone class, prednisone, prednisolone, and a variety of injectable cortisone products. The cortisone products work, but they have a side effect profile that is undesirable. That side effect profile is drinking a lot of water, urinating a lot, and an increase in appetite. Short term, we can live with that if we get the response we need to calm down the itch, but on a long-term basis, it's detrimental to many organ systems to keep a dog on steroids. We now have targeted medications, orally as well as injectably, that will target the chemical messengers that actually drive the itch response. And we can do that without the side effects of thirst, urination, and appetite. So it's a breakthrough in veterinary medicine. So remember, itch is a clinical sign, and the diagnosis comes from a careful history and physical exam at your veterinarians. So if you're having itch and you have an itchy dog, hopefully you'll seek us out here at the Grady Veterinary Hospital, and let's work together get a diagnosis and an effective treatment plan.